Today, we have an outstanding show for you today. We have three guests with us today. We are super excited, and we're going to learn about Hamilton Health Center, community vaccines and testing, and workforce development. So we are joined by Bradley Gebhardt, Kim Craig, and Melissa Burnett. Welcome, guys. Thank you so much for being here.
Well, thanks for having us. I really appreciate it.
Yeah, of course. We have been looking forward to this show forever. And when my son asked me today, who's going to be on the show? I said, everyone from Hamilton Health. And he said, ooh, that'll be a good one.
Kudos to your kid.
Yeah. So why don't we go one by one? Brad, tell us a little bit about yourself. That way everyone can know a little bit about yourself, and tell us how you spend your days.
Sure. Okay. I'm Bradley Gebhardt. I am the development director, which includes marketing and advertising and PR for Hamilton Health Center. And anytime Hamilton needs some media relations, some marketing or advertising to the community, or just general ad agency work internally, I'm like a brand ambassador for Hamilton Health Center. So every day it's new and different and fun, from doing something simple like getting a check request done so we could pay a bill, to on the Hagir show. So everything under the sun.
I love it. They could not have asked for a better spokesperson. You took me on. I was good enough or lucky enough to come on a tour with you, and it was like I got the full shebang. Like, you knew the history, all of the perks, all of the behind the scenes. It was beautiful. So you're very, very good at your job.
Well, thank you very much. You're too kind.
Yes. And go ahead, Melissa, tell us a little bit about yourself.
So my name is Melissa Burnett, and I am the Workforce Development Manager here at Hamilton Health Center. I do have lots of different roles, one in which I am the BLS instructor for all of the Hamilton Health Center employees. So I make sure that everyone is certified and recertified in BLS. I also do some study group sessions and competencies for medical assistants. And also I am part of the workforce development group, and I make sure that we reach out and try to fill the needs at the health center itself as far as employment, look into any upscaling for additional training for our current staff, do health fairs, and pretty much anything that's needed.
Keep everything running behind the scenes. I love it. Yeah. And what about you, Kim? Tell us a little bit about yourself.
So my name's Kimberly Craig. They just call me Kim around here. I'm the community health manager at Hamilton. I oversee our COVID, right in the middle of the pandemic. So I oversee our COVID response team. So all of our community COVID testing, as well as our community COVID vaccinations.
Okay. I was hearing about you being called the vaccine queen. I was like, excellent.
Kind of I thought I would never have, but yes, I embrace it every day at this point.
Nice. So Bradley, why don't you tell us a little bit about the history of Hamilton Health? I feel like some people, I can only speak maybe from the West Shore perspective, we have heard about Hamilton Health. It has a sterling reputation, but tell us a little bit about where it came from and where it is today.
Sure, of course. Well, thank you. And stop me if I go a little too long, because I'm very proud of our history. We started in 1969 inside of a trailer. Basically, a few doctors realized that the community in Allison Hill and Uptown were not getting the services that they deserved. So they actually went house to house and asked the residents, what do you need? From diabetes to high blood pressure. So they set up a trailer, literally a trailer, in front of a Lutheran church. One side was the doctor's office with all the administration. The other side was the, facility where they actually, gave vaccinations and did all of the medical services. And so in 1973, we actually moved into that church. And most of the people know Hamilton at that Fulton Street office, which was just a big block building with no windows. And, we were there from 73 to 2012. But Hamilton's quality of care, the people that were there, we served a community that was very underserved. And we just had a great staff of committed individuals, excellent doctors from all over. Because again, Hamilton does get that reputation, honestly, because of the service that we provided. Now, over the years, we were one of the first in the area to have a Wic program. We had a whole dental service area. We had a vibrant social service And if anybody wants to learn more about Hamilton and where we are today, please visit our website at hamiltonhealthcenter.com. But after a while of expanding and growing, we literally outgrew our building. And in about 2012, our visionary leader, Mrs. Janine Peterson, along with the board, decided, you know what, we have to find a bigger spot. And a lot of the social determinants of health, which include, poverty, violence, education, and transportation, all gelled to say, you know what, let's find a location in the heart of the neighborhood where much of those issues were most felt by the community. And let's provide a one-stop, state-of-the-art medical mall so that a person can come to one location and get all the services that they need. Hence, the 17th Street location was born. So at this location, we have, of course, your medical services from women's health to adult medication to pediatrics. So any primary care service that you do need. But we also have a Quest laboratory here, a medicine shop, pharmacy, and an imaging area so that you don't have to go anywhere. You can get it right here. We have a full service dental department. Everything except for cosmetics you can get here. We have vibrant social service programs where we provide opioid case management service, HIV treatment, counseling, and testing, STD treatment, counseling, and testing, a brand new eye care center so you can get your eyes checked. I mean, just think, a kid, who may never have had a chance to get glasses and having issues in school can get some glasses and bring out that intelligent human being that they, couldn't see the board. Wic Program. We've got a Reach Out and Read program where we provide books to young kids free of charge and kind of get them started reading. So the list goes on and on and on. So, Hamilton Health Center has been providing those services for over 52 years now. So
Beautiful.
Yeah.
Beautiful. I was blown away.
One of the things, sorry, Heather, you might not know that, Brad, but the Hagir show was at Hamilton Health Center, the new building, and we did a whole episode about HIV and prevention, safe needle use, all of that. And they were so welcoming. They give us a place. We did film at that location. And another thing that many people know that I did use the services. I was one of the, recipient of the whole services that Hamilton Health Center provided. And when you guys were at the Fulton building, the church, the one you were talking about,
yeah,
I think that was in like 2001. And what you're just saying is true. As you're speaking as someone who worked there, but I'm speaking as a patient or someone that took services or got services from Hamilton Health Center. At that time, I didn't know, I was new to the country. I was new to Harrisburg. And, I got dental, my very, very first dental check here. I came from Sudan, and dental is like, unless your teeth are hurting, you don't see the dentist. So my first was with Hamilton Health Center. And when I had my daughter and went through my domestic violence, I received WIC help and all of those services. So there is no shame of getting the services if you need it, and knowing just the assurance that this place still exists, it gives me really hope and make me feel good. So
thank you very much. Well, thank you
for everything you did for me and every woman that needed the help at some point of their life.
And thank you very much for that, because I think I can speak for all of us who work here, is that, people like you and those wonderful testimonials, help us come to work every day, knowing what we can do to help our community. So I really appreciate that. And as you know, we have a very multicultural, multilingual staff. The clients that we have are the same. It's like United Nations here at Hamilton. It's a wonderful place to be. We've got full-time translators, and we have systems where we can translate up to 150 languages. If you don't have insurance, it doesn't matter. We have a sliding fee scale, and we can help you find insurance. So yes, we do everything we possibly can, because in my opinion, Hamilton Health Center is the place that people first call when they need a place to go. We're not the place of last resort, just the opposite. You know, people know that if they coming from, let's say, Sudan or from another country, that Hamilton will be a place that takes their insurance. Hamilton will be a place that provides excellent quality care from doctors and physicians who have and understand your culture and understand and speak your language, or we'll find that for you. So again, we're the first place people call, not the place of last resort.
And what differentiate you from any other places is the welcoming. And I said this about Hack, and you always hear me talk about Hack, how my first experience that I felt I can do this and I'm welcome, and no one was looking at me as I'm invading or everything that we hear now, you know, you're taking our job or everything. So the same feeling that I got from Hack, I felt from the people that dealt with me there. And that difference, that's truly, and both of you, Melissa and Key, might not know that because you work and you don't hear it enough, people saying thank you. And you made a difference. You made a huge difference in their life, but I'm going to tell you right now, you truly do. So thank you. Thank you both. Heather, sorry, I got emotional a little bit with you guys and I changed your subject. So who's next?
Well, I was going to say, and thank you for that. We really appreciate it. And we do need to hear it. So thank you.
Absolutely.
Yes, thank you. We appreciate it.
So Bradley, you and I had talked about a little bit of what Hagir was talking about, how sometimes there's barriers. And so like when I'm a 17-year-old mom, I'm like, if I don't have a ride there, I'm not going to get anything. I'm going to give up. If there is an issue with insurance, I don't have the time. I don't have a printer. I don't have access to this. And so being able to add in things that are good things like ease, convenience, consistency, the languages, all of that helps. Even like parking, that helps, because sometimes when you are in poverty, or if you are just busy, or if you just don't have the time, or a child is sick, right in the moment you might need Hamilton Health, you kind of really took all of those barriers down and made it as easy as possible. And then if you come there and you can get your blood drawn there, you can get your imaging done there, it makes it so you can't really make an excuse. You can just go and actually get everything done without any of those things popping up in your way.
I just want to ask you both a question. Can I put you in a testimonial video and put it on our website? You guys are wonderful.
You know your
It's like
answer
a
for
step
that.
back.
You know the answer for that. I've
Thank
been
you.
in, and I did, like I said that to Hack, you know, I've been in many videos for Hack, but I say it became like a full circle, you know. Once I got the help, and you don't want to sit there, and I'm saying that to everyone who needs the help right now. You might need it right now, but don't rely on it. Try to get better and give back. Come back and try to help the ones that help you. You know, and I know that might not be possible for a lot of people, but you know, just do what you can to. So I would love to. Count me in.
Oh, thank you. And I would be remiss if I didn't say we had several other sites. We have grown. So now we have a site in Newport, Perry County. So we're serving that area. Up in Northern Dauphin and Millersburg, a site at Union Deposit. And we have opened up a brand new pharmacy as well. So yes, we're providing that same quality care in other areas of the county and the region. So more to come.
I love it. I love it. And if anyone is watching this, if you are experiencing barriers, there's no shame in that. Everybody is going through the same thing. And so everyone can relate. So when you can finally find yourself in that final destination and everyone there can relate and give you the help that you want, it's well worth the effort of getting over those. So help us explain, I want to talk a little bit specifically about COVID, how you guys adapted when COVID came, how you guys have worked with your mobile or your vaccination sites, and help people understand who can go there, when they can go there, kind of give us like the logistics of vaccines and testing. And anyone can take that.
So in response to COVID, one of the things that the first thing long before vaccines, obviously, was testing.
Mhm.
So we started off just doing testing here on location. That quickly expanded to a mobile testing unit that actually drives around. You show pictures in your title sequence of our beautiful, beautiful trailer that we actually do our COVID testing out of. We drive to different locations throughout Dauphin, Perry, and Cumberland County to provide mobile COVID testing to those individuals that may not be able to get here to the 17th Street location. So currently, looking almost 2 years and down the road,
Mhm.
that mobile unit goes out primarily from the early spring to late fall. Once the winter time hits, we pack it all up, and it does become, more stationary. We don't travel as much. So when we're here on site, we do provide COVID testing here at our community annex building. So it actually has like a mobile where you can drive up and you can actually get your COVID test done in your vehicle. You don't have to get out. You don't have to come inside of a building. Your test is done right there in your car, right on site. We usually get the results back in about 3 days, depending on the labs, depending on, how high the numbers are, it actually, affects how quickly we get the results back.
Mhm.
But the good thing is, like I said, it's right here on location. You just drive up, you get your test done, and you drive off. And we do that, actually, we provide that service every Tuesday from 4 p.m. to 7 p.m. If anyone wanted to call to make an appointment, the number here is 717-230-3991. They can call that number. I will tell you, as of right now, we're completely booked for tomorrow. So
Okay.
tomorrow's Tuesday is full. But they can call on a normal week. If you get a chance to call ahead of time, we are here Tuesdays from 4 to 7, and we serve ages 5 and up for COVID testing. Now, that was our initial response was COVID testing. Obviously, last December, once the first COVID vaccine hit the market, we immediately jumped on that and we started providing COVID vaccinations. We currently offer all 3 vaccines. So the Janssen, which is also known as Johnson & Johnson, we offer Moderna and Pfizer. Pfizer, we offer ages 5 and up for Pfizer, and for the boosters, 12 and up for Pfizer. Moderna and Johnson & Johnson are for 18 and up, but we provide the boosters for them as well. And since last December, we've provided over 5,000 of doses of those vaccinations.
Wow.
We're actually close to a little bit close to 6,500 at this point. And COVID tests, we're about the same amount, about 5,000 for those as well. So considering our population, I think that we've done very well targeting what we need, who we need to target. And we serve anyone. You do not have to be a patient here to get a COVID test. You do not have to be a patient here to get a COVID vaccination. You call that number that I provided, and you can schedule the appointment right here with us, and we still see you as long as you meet that age category.
I love it. You answered all of my questions.
I will, repeat the phone number again, because I know I kind of said that kind of fast, but it's 717-230-3991. And again, they can call that number for testing appointments and vaccination appointments. So
Beautiful.
that's how Hamilton has, really grasped what we need to do externally and internally as far as providing vaccinations and testing. But again, for our clinical staff and for our other, supportive staff here, we provide full PPE so that we're all protected. Our heating systems have been changed to accommodate, this is an airborne infectious disease. So we've had all those changes made to our building so that, things are, can be healthy for us so that we can we can stay healthy so that we can serve the community. Another thing that we've done here internally is that we provide COVID testing for our employees. So our employees don't have to go somewhere else to get tested. If they need a test or they've been exposed, we provide that testing here for them on site so that they don't have to be inconvenienced and go someplace else. So we also oversee that. If somebody comes in from the public, we always have, masks at the front door. We've changed our, entrance and exit so that, we can try to eliminate, cross-contamination. We try to keep the social distancing. So everything in our building has been adjusted accordingly to try to fit, where we are right now in the middle 21 months into a pandemic.
Right. Yeah.
I think that we've really grabbed a hold of what we needed to do in order to, accommodate so much, confusion and chaos. A lot of people didn't know what to do, and I think Hamilton did a good job of adjusting to what we needed to get done.
Yeah. Beautifully said. We've got the number here in the comments. We've got stuff, links everyone can click on if that is something that you're interested in. Can you tell us what are some frequently asked questions that people ask either about testing or the vaccine? Is there any sort of hesitancy or a question that you think is the most common that you could answer for people that might be wondering?
For testing, the most common question I get is, do we provide rapid testing? I can say that we do not. Our tests are PCR, which means they do take 24 to 72 hours to get back. There's no rapid testing provided for the community. Another question I get for testing quite frequently is, do we know which variant? I can tell you that we do not. That is not the type of test that we provide here. It is a general PCR test that will tell you if you're negative or positive. The other question I get is it an antibody or antigen test? It is an antigen test. The difference between an antibody and antigen test is an antibody will tell you if you've had COVID previous. Antigen will tell you if you are currently infected with the disease, with the infectious disease. So we only provide the antigen test here. So those are the top three I get for COVID testing. For COVID vaccinations, the other one we get, the main one we get a lot for vaccinations is, should I even get it? A lot of people are wondering, is it even safe for me to get, especially in the population that we serve. We serve a minority population that has a lot of hesitancy against, vaccinations in general, not just COVID, but vaccinations in general. And with a new vaccination hitting the market, there's a lot of, should I get this? Is it safe? And my answer to that question is, number one, talk to your PCP. Your PCP can tell you exactly what is safe for you and what isn't, because everyone's health conditions are different. But generally, we would say that it is safe for you to get that vaccination. The CDC has done their research and they've released these vaccinations for to kind of, prevent, it's not a cure, but it's a prevention. COVID. But again, go back to your PCP if you have any detailed questions. I don't like to answer those. I'm not a provider. I am a nurse, but that doesn't, I think that that's better for you to talk to your doctor about what you should or should not get. The other question I get a lot for vaccinations would be, which one should I get? If it's yes, I should get it, which one? Again, they're all been deemed safe for the public, again, but you should talk to your PCP if there's one that may be recommended over the other. And the last one I get for vaccinations is, how many doses do I need? Believe it or not, people still ask that question. And it is 2 doses with recommendation of a booster at this time. And that's the general about what I hear.
That's beautiful. Hagir and I have done more than one show with our good friend Netta. She is an epidemiologist, and she would talk about the different questions, and that was basically the same. And is she in the Midwest, Hagir? She's kind of hearing the same exact thing.
She's the infectious disease doctor and a dean with Nebraska College, and it's everywhere. That's not just Pennsylvania here. You're going to hear the same question everywhere, and that's why we focus on education. A lot of people have questions, and it's normal. Lack of trust. It's not something new. It comes from our personal experience or what we hear in the media and all of that. So many false, misleading information out there. And that's why you just have to do your own research and talk to the doctors, like she said so many times. I'm a nurse too, but I always say, go to your doctor. I can give you advice based on my knowledge and my experience, but everyone is different. So, yeah.
And so let's talk a little bit about workforce development, because I think a common theme here which Pat in our comments, she's a loyal watcher of the show. She talks about how we always are talking about community, no matter what show we're talking about, no matter who we have on the show, we're always talking about community. So talk about workforce development, why that's important, who that's directed at. And I feel like that is a good indication of your commitment to the community and your commitment to have a sustainable future in the community to actually develop your workforce. So if you don't mind, speak on that a bit.
Absolutely. So the title of Workforce Development Manager for Hamilton Health Center is a newly created role. When COVID hit, we also experienced shortage in our workforce itself because a lot of single mothers, they had to be home with their children, daycare shut down, schools closed. Just for a lot of various reasons, we were impacted as far as our workforce, as many other organizations were. And certainly in the healthcare industry, we need to continue to be able to provide services. So the need became in particular for medical assistance. So I was tasked with just creating a program and reaching out to an educational institution so that we could essentially train our own staff. So people within our organization that were currently working in other roles that were interested in now becoming a medical assistant, as well as to individuals who did not currently work at Hamilton Health Center and they were looking to get into the healthcare field as a medical assistant. I did the research and we found a partner to be the educational component. And with that, we established a medical assistant program, which is 8 months in length. The students actually, they're online at their convenience with an instructor from the NEMA, which is the National Institute for Medical Assistant Advancement. They are providing the educational component. They're able to get on at their availability, which again worked out really great with COVID and everyone having to have a flexible schedule. They also come into the lab with me to practice all of their hands-on skills. So everything that they're going to learn as far as the knowledge-based component, they will have to do in person with me just to ensure that they do have the skills down. They also are able to obtain their externship hours while they're learning. So during that 8 months, they are accruing their externship hours and they don't have to wait until the end of that 8 months to now do an additional 240 externship hours. They also sit for the CCMA certification. So that way, once they successfully pass that, they now have the credentials as a certified clinical medical assistant. And another role that I was tasked with was creating an apprenticeship program. So I'm happy to say that Hamilton Health Center is now a state-approved medical assistant apprenticeship program. So once our students complete all the requirements as far as obtaining the credentials as a medical assistant, they are then offered a full-time position at Hamilton Health Center working in that field, and they go through our apprenticeship program for 1 full year. They are being paid as they're learning and getting the on-the-job experience. And this, again, was essentially created so that we can have a pipeline of medical assistants to sustain our patient population and just to keep fully staffed. In that, we also reached out to a few of our existing medical assistants who do not currently have the CCMA certification. So I created study group sessions where I meet with our medical assistants every day for an hour for 5 weeks. 5 days a week to do study group sessions in preparation for them to take the National Healthcare Association exam, which once they successfully pass, they will then have that CCMA certification. And they in turn will also go through our apprenticeship program so that way we can cross-train them across all 3 of our clinical departments. So that way we aren't short of staff. Everyone has the availability to work in any clinical department as the need arises. So that was the medical assistant program. Also, we have various other positions that we are hiring for. So workforce development also spills into that by going out to the community when there are different health fairs. We participate with as many as possible. Hamilton Health Center also started holding their own job fairs, or we like to call them hiring events, where we have them on site at Hamilton Health Center. So it's open to the public, including our patients. We have it in our community room, and we have supervisors and managers on hand. So when applicants do come in and they apply for a specific position, they're able to have an interview at that time. They get to ask questions of the direct supervisor or manager for that position. And it's just been really working out well as far as just having our own internal job fairs. So that's pretty much workforce development in a nutshell, with a few other pieces.
I love it because it seems like it's a very practical solution. We are in the midst of people changing, different careers changing. The pandemic has brought about, I think, has put a lot of things into contrast and shined a light on a lot of different things that were going on. So to be proactive about it and practical about it, not waste people's time, get them in right away. So if someone's watching this and they're thinking about something like that, who can apply for something like that? I know your job fairs could be maybe anybody depending on the position, but specifically for medical assistants, I might have missed that part. Who would that be open to?
So this is actually open to everyone. We did keep in mind with our patient population, so certainly reaching out to minorities, to single parents, incumbent workers, just anyone who is looking to have sustainable income in a career that they will always have employment. So ages 18 on up, they are able to apply for this. We also partnered with the Pennsylvania Career Link in regards to connecting our candidates to them to apply for WIOA funding. Once they complete that whole process and they determine if they're eligible, most of the candidates are eligible for the $5,500, which is the max that they can receive from the WIOA funding. So that way they don't have to pay anything out of pocket to become a medical assistant, which is really unheard of. Unlike traditional medical assisting schools, the program itself is $7,000 through NEMA. Traditional medical assistant schools, it's almost double that amount, and there aren't that many in this area as far as the traditional medical assisting schools for individuals to go to. So they are very happy to, be able to have this as an option. And we've also partnered with Harrisburg University for their medical assistant program, which is completely asynchronous. But the students, once they complete all of the knowledge-based component, they will come into the skills lab with me to do the hands-on portion of it. And then that guarantees them a spot here at Hamilton Health Center to complete their externship hours and apply for a position once they've completed all the requirements. And if they're hired, they in turn will also go into the apprenticeship program.
Love
And
it.
that's a huge, Heather can tell you the same thing. It's money and finding funds and grants and all of that. It's the main obstacles that's preventing many people from seeking, going to colleges or even getting a degree. I always tell the story, like I had no money and I wanted to do the CNA. I don't know if you guys do certified nursing training or no.
We do not.
Okay, yeah, had that $500, and I had, and it's not accredited program, so you can't apply for financial aid, so you have to come up with that money. I don't have that money, and I went to PSCCU, applied for a credit card. They give me that 500, and that was the best 500 I spent. I used that credit card to pay for this. So sometimes you have to figure a way. If there is no door, knock that wall and build your own door. So some people might not do it, but knowing that you guys offer this and you connect them, and can you please repeat that again, the 5,500, how people can get that?
Absolutely. Another component that I wanted to share with you all, there is also the option for individuals who are not currently employed with Hamilton to apply for one of our entry-level positions, which would be a non-medical position. So that way they can get their foot in the door, earn income while they're going through the NEMA program. So we offer that as well. And the students were working part-time. So again, to take out that barrier as far as, I want to get an education, I want to go to school, but I need to work as well. I need to earn an income for myself or family. So Hamilton put that option out there. NEMA is also newly accredited, so students are able to apply for the federal loans as well as the Pell Grant. The partnership that we have with Pennsylvania Career Link, where they would apply for the WIOA funding, and they will determine once they go through the vetting process, if they're eligible, and if so, how much they're eligible for, and the max amount for that WIOA funding is $5,500. The tuition is $7,000. So we also have a partnership with Labor and Industry, where they reached out and said, we have an additional $1,500 for the individuals going through the school. So again, this program is created to be at no cost to the students while they go through to become a certified medical assistant.
Have I said you guys are amazing? Did I say it before? And I say it again. You're amazing. Thank you. Thank you is not enough, honestly.
Well, thank you. And you can see why my job is so easy as the PR guy, because we just have such wonderful people and such wonderful programs.
You are absolutely right. You all are the perfect fit. Like you all fit in that puzzle. You're just like, yeah, connect. I'm not good at doing that, but I try. Yeah. And I can't make a heart. I can, for the life of me, I can't do that. But heart, I'm sending you my weird shaped heart.
Close enough, close enough.
Feel the love, feel the love.
So I am the only person on this Zoom who can't answer my next question, but I want to ask everyone here, including Hagir, if you're in the healthcare field, I kind of want to hear from your words what it's been like. What are the highs? What are the lows? Like, we can obviously tell that Hamilton is like such a great place to be, and you guys are adapting, you guys are adjusting to the realities and trying to do it with grace and still keep your values intact. But also we know that this is a crisis, and we know that everyone in this field is going through something they've never gone through before, and you guys are really taking on a lot of things, more so than other professions. So talk to me about the highs, the lows, anything that's been surprising through COVID, and just kind of give us some context. I think sometimes we guess what you guys are feeling, where you could just tell us. So Bradley, why don't you start us off?
For us, I think one of the main challenges, and Melissa and Kim can talk about it from a ground level, but I'll give a little overview, sort of a upper thing, is just the changes and the rules and regulations that come down from the government or from whomever every day. I mean, we're always having to adjust, whether it's vaccine mandates or guidance from the CDC or from this agency or that agency. So over the last couple of years, there have just been so many different mandates that we have to follow that continually change. So again, Hamilton is very flexible, malleable, and we do make the changes, but I think that's been one of the challenges from sort of our level. It's like, okay, today we need a new sign to go out front, because guess what? Yesterday's sign is no longer value of whatever. Valid, thank you, valid, because the rules changed, by the way, so on and so forth. So that's been one of the challenges for the last 2 years of adjusting and changing and things like that. Yeah,
you probably have such a tolerance now. You're like, whatever. They're like, we now wear masks on our hands. You're like, whatever, it's fine.
Exactly.
Just go. It doesn't matter.
But on the positive note, because it's very optimistic, is for me at least, I liked being at the forefront of the pandemic, because coming to work every day, being in the healthcare industry, you kind of know what's happening and what's not happening, what's real, what's not real. And so it's just been good to be sort of there on the front line. So you're not reading about something 2 or 3 days before, you're living it day by day, moment by moment.
Excellent answer. What about you, Melissa? What did you find is most surprising?
Not so much surprising, but what one of the highs for me in particular was just to see how all of our staff at all of our sites just so quickly adapted to all of the different changes, some of the ones that Brad had mentioned, but how we all came together just wanting to do whatever we could to help our patients feel comfortable and safe and deliver care, in a safe manner, keeping ourselves safe as well. So as things became, so fluid with all the different changes, Hamilton just jumped right in, and whatever it is that we needed to do, we made sure that we did it in a timely manner. One of the things for me, I guess, that has been most heartbreaking is just to see the loss of life for a lot of individuals who didn't necessarily believe that COVID was real, or not wanting to take the precautions, even wearing face masks, social distancing, just not really giving it the serious attention that it certainly needs, and in particular for the youth. So being able to educate everyone, but most certainly the youth, so that they understand and know that COVID is still here. There are some things that we do have within our control to help, prevent it or minimize the transmission. Just giving them those tools that they need to keep themselves safe, and just sharing it with everyone within our household.
Mm-hmm. And imagine how important it was that you guys had built that reputation up over 20, 30 years, that by the time everyone needed a leader and someone to cut through the noise and to have answers in the midst of the chaos, you had already built up everything that was needed. So it's like so beautiful that you were there and able to do everything. So Kim,
Yeah.
why don't you tell us what's a high, what's a low during this crazy COVID time?
I would start off with the high. The high is working in this field and seeing the level of respect that healthcare workers and essential workers really got during this time. I think Hagir could probably relate, and Melissa, if you have been anyone that was a clinical staff person prior to COVID, I felt like we were looked over for a long period of time. It's like not that we didn't exist, but no one really acknowledged what we did and brought to the table. And then all of a sudden COVID hit, and you're seeing, on the news, and the people are cheering you on and encouraging you and applauding you for what we do. And providing that clinical work can be stressful. So it was nice to see people just giving you credit for just what you do every day that felt so swept under the rug prior to COVID. Mm-hmm. And it just being known as a healthcare hero or even essential worker during this time was definitely a high for me. Now, I would say the low is also the same thing, because, it's difficult sometimes getting up every day, coming to work in the middle of an unknown pandemic. You didn't know what to expect. Just like Brad said, the changes every day. That was difficult, and not knowing exactly what we were dealing with in the beginning. So the fear of, am I going to catch this virus? Am I going to take it home to my family? Am I going to, be able to keep going when we had staff members and coworkers and colleagues that were, now leaving the workforce? So now we're short-staffed. So now we're burnt out, and we're not just afraid of the virus. We're tired. We are, just feeling that burnout. And that is definitely the low, because it's tough. I mean, even with my own clinical team, you try to stay motivated, you try to stay optimistic and positive, but that's very difficult to do when you are working at an extreme pace and you're working with minimal staff, and the staff that you do have, they're tired. And it's thankful that we have programs like the Workforce Development Program, because that helps us bring in more staff. The problem is it's a little slow, right? We're not going to have anybody in here tomorrow, but at least it gives us hope for the future to come. So it's just basically just trying to stay motivated and trying to stay encouraged through this low, so that we can get back to the high. So
The fear of the unknown, okay, yeah, this is the big thing. You probably all remember when we were washing our vegetable on boxes and coming from work. I always did that with my kids even before the pandemic because I don't know what I'm bringing in. So I literally strip in my garage. Like I take my shoes off, my uniform, and they know we do air hugs. I run up to the bathroom. They come talk to me about their day while I'm taking a shower because you work 20-hour shift, 18-hour shift, and then you have to get up tomorrow morning in like few hours. So as a mother, you have to put all of that. And I think a lot of people don't see it. You know, when you say nurses burned out, this is not a new thing. It came out now with the pandemic. But as a nurse, I work at the hospital. The shift is 12 hours, but you know damn well that you don't leave in 12 hours. So you come home, you only have like 4 hours with your kids. So either you be in their life or you're going to just, you know, not be there. So you can make it work. But even after this pandemic, anyone listening to us here, the healthcare, not just everyone in healthcare, but everyone that does work for you, appreciate them. And it's not going to hurt you to just say thank you and to acknowledge that they are saving your life some way or another. The one way making your sandwich is saving your life, feeding you. The cashier is helping you. And most definitely the nurses and the doctors and everyone that put their life every day at risk to make sure that you are okay, neglecting their own family and all of that. So yeah, it's always high and low, Heather, to just sum it up.
And I piggyback off of what you were saying, just in general, just all the essential workers from the grocery store workers. Like we saw that initially when the pandemic hit, they were rationing items. You know, you get 2 cases of water, that's it, you know, per person. The shelves weren't able to stay stocked. You just saw how everything was affected one way or the other. A lot of restaurants shut down because, again, they lost workers. Pretty much every industry was hit. And as Kim mentioned, the one thing, at least from the healthcare perspective, is it showed how important it is at every level, you know, for healthcare workers in particular, because we don't get sick days, we don't close down. We have to be open, you know, all the time. You know, working at a federally qualified health center, we do have some weekends and we're closed on Sundays, but for the most part, we don't shut down. We didn't have the option of, oh, there's COVID, so you can't go to work, everyone just stay home. We still had to be there on the front lines. Initially with the COVID testing, we were outside in the cold and everything, just doing the COVID testing. We were suited up, you know, and we were there till like 10 o'clock at night sometimes. And just being exposed to the elements, and again, just not really knowing at that time a whole lot about COVID, you know, just putting ourselves at risk. And having to go home and go down to the basement before I went into the house and, you know, put my clothes in the washer, things like that. So that's the one good thing for me, is that people are, you know, finally able to see, you know, the healthcare industry in particular, they have been overlooked for a large part of, you know, the existence. And I definitely think people appreciate now, you know, how hard it is to work in that field and just, you know, not have the option that some other positions might have where, you know, you don't have to go to work today and literally no one's life is going to depend on it.
Like at the beginning, I talked about how you guys get rid of the barriers because you introduce ease and consistency and convenience. Well, like all of that exists because of you. Like you are the ease, you are the consistency, you are the convenience. It's not just like the building is like centrally located. It's because you guys keep showing up every day at a high level that all of those things exist. And if you weren't there, it would just be an empty building and it wouldn't matter. It's incredible.
A nice fancy building, that's it. But no. And thinking outside of the box, like having a center in a good location is a good thing. But you guys solved the problems. Like you looked at what you need. Okay, those people in the area, they cannot like afford to go from one spot to another. So you brought everything in one place, and that's that takes thinking and passion. It's not, that shows me that the goal is not to make money. The goal is to actually help the people around in the area to get better and get help. You have the Wic, you have everything in one place. So one big stop shop, basically.
Yeah.
Exactly. And that is definitely our goal. We're a health center, but a community health center. So we're in the heart of the community. We're a part of the community and we serve the community. A lot of our staff live in the area, in the neighborhood as well. So we're integrated inside and out.
And I just want to touch on, I know you mentioned it, Bradley, at the beginning, but I want to touch on one more spot before we wrap up here. The sliding scale. If someone needs healthcare, if they have a dentistry need, if they have a need for something, if they have someone in their family with addiction issues, talk about how Hamilton Health helps people actually afford and pay for any of this.
I use the sliding scale.
Actually, yeah, the sliding fee scale based on income. So you'll pay a little something, but we won't turn you away for not having health insurance. However, we do have 4 enrollment specialists because we will help you navigate Compass to apply for benefits that you need, whether it's Medicare, Medicaid, or even the Affordable Care Act. Because even though we may have a sliding fee scale and we refer you out, the next place you go may not. So we want to make sure that you are covered. And in addition to that, in between the time when you apply, and again, we offer all the assistance to make that application possible. And when you actually get the insurance, there are other programs that can kind of fill that gap that we'll refer you to and provide resources for so that you can get some benefits in the meantime.
Amazing. Well, everyone, we like to end our show with a lightning round where we can ask a couple questions of everybody. You can answer first thing that pops in your mind. You have taught us a lot about workforce development, vaccines, community, Hamilton Health. We would like to leave learning a little bit about you. So if you are ready, I will just call you out. I'm going to ask a question. Everyone can answer the same question, and we'll do a couple of these before I let you go because I know you guys are busy. So first question for you in the lightning round is, what advice would you give your 16-year-old self? So Bradley, why don't you start us off? What kind of advice would you give yourself?
Ooh, I want to know.
16-year-old Bradley.
Advice would I give my 16-year-old self? Gosh, when I was 16, I think I was coming back from Latin America. It's a good question. I don't know. Just kind of be your optimistic self. The world is a great place. You know, enjoy it. Who knows? Maybe I started life as my degree's in fine art, so I started life as a freelance artist. And even though it was a wonderful time, you know, that bon vivant lifestyle of the artiste, maybe I would have said, you know, be a little more practical and maybe get something, you know, some real job first, but maybe not, because, you know, being a freelance artist was a great time too. So good question.
Good answer. Good answer. What about you, Kim?
Oh, listen to my parents more.
Ooh.
I should box that and send it to my 14 years old.
Yeah.
I'll be still living at home if I listen to them and have a lot more money in my pocket.
Don't we all wish if we listened?
And that was 20 years ago. I'd still be living there. I'd be like, that's it. I'm not.
That's great advice. What about you, Melissa?
For me, I would say everything that you went through is going to pay off, and you will obtain the goals that you have set. So everything that you're going through has a purpose, and this is a teaching moment.
Amen. Keep going.
You guys are amazing.
Let's go in reverse order. Melissa, who is someone who has influenced you? Who made a really big impact on you? Someone in your life that was a good influence?
I would say my husband. My husband is a pastor, and he has a youth program that he started 20 years ago. And he and I grew up knowing of each other, but never really interacting. So I actually knew him since I was 12. And we actually connected in the community doing our perspective outreach and work that we did for the community as a whole. But he is just someone who is patient, loving, very kind, just passionate about humanity in general, but particularly for the youth. So he is definitely inspiration for me.
Jackpot.
Do they still make those? Brad is one
Can I
of
get that on
them,
Amazon?
Took me a few decades to find him, but they are out there.
Brad can answer that because we know you're one of them, one of the good ones. But do they make some of those anymore? He's like,
gotta
I'm
search
not
for 'em."
answering that. He's been a politician now. Yeah. Oh, she answered you already. All right, next, Heather.
I'm sorry. Is it me? Is it my turn?
Yep.
Okay.
Yep.
I would actually say my son. He's not so much an inspiration as he is a motivation. Once I had my son, it really kicked me into gear to want to achieve more, because I wanted to give him the life that I did not have. So he's 10 now, and I've managed to go back for my degree. I've gone back to further my education twice over since he's been born. So that alone, I mean, just looking at him every day motivates me to want to do better, so that I can be a good example for him. And like I say, give him a good life based on the work that I've done.
Fabulous. Fabulous. What about you, Bradley?
Yeah, over my life, there have been a lot of, artistic mentors and little moments that you look back and say, yeah, that kind of changed my direction. But I'm going to go with what Kim was saying, because my daughter, I mean, we have, as you guys know, when you have kids and your kid is, growing up, I mean, it just centers you. It makes you think twice about who you are and what you're made of. It makes you think outside yourself. There aren't too many people you take a bullet for, but your kid is definitely one of them. And then as she's grown up into a young adult, and the way she thinks, it tests my thought processes every day. And it's great to get into great conversations and realize, oh, I never thought of that. Or, yeah, I'm a little, and I get the good, the bad, and the ugly from the kids. I was like, okay, I guess, yeah, I got ways I can improve too. So it keeps me humble, but always growing. So it's been, a great journey and many more years to come. So.
Excellent answer. And we will end on my favorite question. What is your guilty pleasure? So, Bradley, top of your head, what is your guilty pleasure?
Guilty pleasure. Well, I guess the good news is I don't really feel guilt about anything, so that's pretty good. But I guess right now it'd be anything sweet because I've been trying a keto diet to, get in better shape and eating healthier. So I guess I'd have to say if I ate a cookie or had some ice cream or, had an M&M, I'd feel not guilty, but realize that I was straying from the righteous path of healthy living. So
a single M&M?
One M&M, Brad. Just
one M&M.
He said an M&M.
Singular.
Exactly. One M&M.
I want to be you when I grow up.
Yeah. What about you, Kim?
Mine is reality TV shows.
Ooh.
I know.
She laughed. As soon as you said that, she laughed.
I love reality TV shows.
Are we talking like Drag Race or like Real Housewives or like everything?
Real Housewives, Love and Hip Hop.
Yeah.
I mean, like, I know it's totally, like I said, it's my guilty pleasure. But the Real Housewives is just like up here for me.
It's easy. I love it.
I'll never live. It's a world I'll never live. So I think I get a little fascinated with it.
I love it. And then bring us home. What do you think? Your guilty pleasure?
My guilty pleasure is watching the ID channel. I love to hear about all the murders and just
Here, here.
real life. People in general just infatuate me. So when they have those particular behaviors, it just makes me want to learn a little bit more about them. So I will watch ID and Lifetime and just I love it.
I love it. I love it. Those are
My
good.
daughter said I'm depressing sometimes. She's like, why do you watch crime and psychopath and like psychology and stuff? Like the mind like really interests me.
Yes,
Exactly.
absolutely. And we live amongst people like that. So I want to learn about them.
I
I'm getting
can't hang.
scared.
I can't hang with you. Like the minute that like I hear like the first like couple minutes of Dateline, I'm like, oh my God, like I can't, like you have to do it for us. You have to watch all of that. You have the running knowledge and keep track of everybody for us.
Mhm.
Absolutely.
I love it. That was a great lightning round. You guys had very good answers. So we asked everyone kind of the same questions, and you guys came at it from very different perspectives. So very, very interesting. We know you're busy. We know giving us an hour of your time was a lot. So thank you for being here. That was so fascinating. You each came with your own perspective. I think we learned a lot. We have in the chat here, we of course have the phone number you can call if you'd like to set up something for testing or vaccinations. We have here, we linked to your recruitment portion of the website. That way, if people are interested in anything that we talked about, please reach out and you can get everything that you need there. So thank you. You have an open invitation. Anytime you guys have something for us, we would love to help you. We can keep the good times going. So please come back again in the future.
Thank
Absolutely.
you.
Thank
Thank you very
you.
much. We really
Bye-bye.
appreciate it.
Bye.
Come back.